To understand everything, whatever is asked, you will definitely write better. You should think, first of all, your concepts should be strong. Then automatically you will write everything. Okay. So, what is pericardium? The outermost protective covering, what we have over the heart is pericardium, which is actually giving stability to the heart. It is also preventing the friction between the moving heart and adjacent structures. It's also not allowing for acute changes, like suppose if there is some more filling, like it limits the ventricular filling, not like not in of course chronic settings. So this is our pericardium. Sternum bone, costal cartilages. Behind the sternum, you are finding heart is there, which is actually enclosed in a bag. The name of this bag is pericardium. So it is conical fibroserous sac containing heart and the roots of great vessels. The great vessels are aorta, superior vena cava, pulmonary trunk, and inferior vena cava. So this pericardium is actually situated in the middle mediastinum. Mediastinum is nothing but area between the two lungs is mediastinum. And in the middle mediastinum, we are finding the heart covered by pericardium. Okay. So the level is like it is present behind the body of the sternum and from the second to sixth costal cartilages. And when you just remove everything behind, we will find thoracic vertebrae. T5 to T8 thoracic vertebrae. Okay. Now, coming to the components of pericardium, we have two layers in pericardium. The outermost covering, you call it as fibrous pericardium. Below fibrous pericardium, we have serous pericardium. Okay, two layers. Fibrous pericardium will be tough and serous pericardium will be slippery. So serous pericardium will have further two layers. What are those? Parietal layer and visceral layer. Okay. So the one which is closely investing the heart is visceral layer. Above visceral layer, we will have parietal layer. Okay. So the visceral layer which is closely investing the myocardium of heart, you call it as epicardium. Visceral layer plus myocardium of heart, together you call epicardium. Okay. Now, between the parietal layer and visceral layer, basically we will have pericardial cavity. Like parietal pleura, visceral pleura, we have pleural cavity. Similarly, parietal pericardium, visceral pericardium, between these two layers, we have pericardial cavity filled with pericardial fluid. Okay. Now, see the one which is very outermost covering, tough this is fibrous pericardium. Strong it is, flask shaped sac. So the base of this fibrous pericardium, this is what is this picture showing you? What is this structure? Diaphragm. So the base of the pericardium is resting on diaphragm. Okay. And suppose if you consider this as a triangle, this is base and this is apex. So apex is in continuation with these big blood vessels. They are called as great vessels. You can see superior vena cava, you can see pulmonary trunk, aorta, all these also are receiving the coverings of pericardium. Okay. Then now, this fibrous pericardium is above, this is the apex area, it is blending with ascending aorta, pulmonary trunk. Okay, and it becomes continuous with the deep fascia of the neck, that is the pretracheal layer of deep cervical fascia. Okay, then below, this is below. Which muscle is this? Diaphragm. Below it is fusing with the central tendon. You remember central tendon? The place where all muscle fibers are getting inserted. You call it as central tendon of diaphragm. Okay. Then, so fibrous pericardium. Now see, don't read anything, you will understand. See, this is the sternum bone. Okay. This is the heart. This is the back of our body, back. So there is connection between the sternum and pericardium. You call these connections as sternopericardial ligaments. Okay, so anteriorly, the fibrous pericardium will have connections with sternum. So this is superior sternopericardial ligament. This is inferior sternopericardial ligament. Okay, so these attachments keep the heart in position. and limits cardiac distension. Okay, then so structures piercing this pericardium. If you remember four chambers of the heart and what are the structures coming from four chambers, only those things. Aorta comes from left ventricle, superior vena cava opens in the right atrium, inferior vena cava also opens in the right atrium. Then we have right and left pulmonary trunks, pulmonary arteries. Okay, they are coming from which chamber? From the right ventricle. All these structures are actually receiving the coverings of pericardium. Okay, they are receiving the prolongations of pericardium. Okay, just a minute, beta.